Hello, welcome to another Alphagenix podcast, where every week we talk to special guests from the world of health, well-being, wellness, longevity, and of course, usually with a bias towards men's health. And today I'm delighted to introduce Dr. Indra. Dr. Indra, you helped me on my journey for many years. We worked together on my thyroid function, gut health, and I'm delighted to have you here to chat to you today. Feel free to introduce yourself.
Excellent. Thank you so much for having me here, Ross. I'm really excited to have this conversation with you and excited to see how your journey has gone from when we've been working together. And I love talking about what we're going to talk about. So, yeah, thank you.
Oh, no problem. It's exciting, isn't it? And today, we're going to chat about functional medicine. So you are a doctor of functional medicine, and it's probably a great place to start to explain the difference. What is a functional medicine doctor and what's a GP?
Yeah. So I guess probably best way to start is where I started my career as a GP. And, going through the normal training processes, learning about what I learned as a GP, started off being a partner, being a salary GP, all of those kind of things that we all know about in terms of being a GP. And then probably about 7 or 8 years ago, just really beginning to realize that I'm not really helping my patients. People will keep coming back, like they may be a bit depressed, or they've got a bit of diabetes, or they've got a bit of IBS and these kind of things. And we all know the 10-minute consultation, and we're really limited in what we can do. And I was always called the listening GP. I always ended up having much longer consultations than I was supposed to. And I was just really trying to figure out, what am I missing here? What's actually happening? And a story that I tell, which is quite interesting, is sitting in my diabetic clinic, and I was going through the results, seeing the next person. And he was a gentleman that had been in to see us, and his blood results basically said that his diabetes was not great. And I was like, okay. So following the processes, following what guidance I was given, he needed to have another medication. So I was speaking to him about this, and I was looking at this medication. It's quite a new medication when I was there 5 or 6 years ago. And this medication would lower his blood pressure, lower his blood sugars by peeing out sugar. That's how it was working.
Mm-hmm.
And as a result of peeing out sugar, there was a risk of him getting uh, infections down below, fungal infections. So here I was trying to treat his blood sugars, giving him a tablet, and then I had to give him another tablet to treat with the side effects. And I was just like, what's going on? Then something within me just said to him, what does diabetes mean to you? And he was like, nothing. I was like, have you spoken to the nurse? I talked about nutrition, talked about, food and everything else. Have you changed anything? Have you done anything? Nothing. So here I was just dishing out medication, treating blood test results, and the patient just kept coming back. He would just go away. 6 months later, have another set of bloods, and then another medication would be added on. That really made me stop and think, really made me kind of think, what am I doing? And then I came across this way of working, functional medicine. And I was like a lot of people, of what's this? This is a bit of like quackery. I think if you type in functional medicine, that's the first thing that comes up on Wikipedia and all of this. I was like, I don't know. It was one of my best friends who went to Australia and started working. And in Australia, they call it nutritional and environmental health. So it's a slightly different terminology. But she said to me, Indra, people are getting better. And I was like, what? I had never really seen people get better other than maybe with an antibiotics or something like that. Otherwise, you start on medication and then you get put on it forever or that kind of thing. So I went and had a look, and I came across this way of working, and it completely blew my mind. And for me, that story that I just told and the principles that I'm going to talk about now really, connect. The first thing that I learned in functional medicine is that our bodies have the innate capacity to heal. I'd forgotten that.
Mm.
Completely forgot that we are not making our body heartbeat, gut move, all of these things. These are all automatically happening. And there is an intelligence within it that we have no control over.
Yeah, there's an innate ability just to do the millions of things every second just so we can have this conversation, or just so we can go to work or whatever.
And that is one of the principles that I think makes the difference. I don't believe that people are broken anymore. I think that people are whole, and your symptoms that you're expressing is actually your body trying to deal with what's going on around you. So actually, it's working perfectly.
Yeah,
and not
absolutely.
normally.
It's dealing with the situation that it's presented with, which results in symptoms. So rather than treat the symptoms with a medication, which is like sticking a plaster on it, you're now saying, no, let's find out why it's doing this, and let's try and solve it so you can heal yourself.
Yeah. So that's the first thing. It's like we have this innate capacity. We have the second principle is that we're all genetically unique. So conventional medicine is very much population medicine. Let's see what the population needs, kind of like, what's the headline picture, right? You've got blood pressure, you've got heart disease. What does the randomized controlled trials say? Right, you need to be on this because that's what we need to do to manage our population. So I like that word, population medicine. Functional medicine is more personalized medicine. We are looking at you as a unique individual and how you are presenting yourself and how that interacts with the world that you are in at this moment in time.
Yeah.
So another principle that I think is really unique to a functional medicine approach. It's a very unique, personalized approach.
Yeah, I love that. And it makes sense, doesn't it? Because all 8 billion of us on the planet look different. Why are we not surprised our insides are different too?
Exactly. I mean, even with the men that you're looking after, you must see that for somebody, testosterone works like this, and then somebody else, it doesn't work quite like that. Everybody has their own touch point. We like having pathways or templates or processes, but that's only a guidance to make sure that we're being safe and that we're not overdoing things or underdoing things. But within that guidance, we have a range, and that's what we're working. And so that's the third principle that I really love, is that we're working to optimize you and not just make you normal.
Yeah, I love that. That totally resonates with me and with probably everybody who's watching this. It's about being the best version of yourself, not just getting by. I was chatting to someone the other day, and they described it as running on empty. They were going through the motions, but they knew they weren't optimal. And that's what I love about the work that you're doing. It's taking someone to where they should be.
Yeah. And even from an optimal perspective in terms of how you're describing it, but also the fourth thing is that we are scientifically based. So in the science of how your body works, where do you sit in that optimal range? Mm-hmm. What is it that you need for your body to work optimally? Which I'm sure you're seeing, there must be like a range for testosterone that's supposedly normal. But for some people, they need to be at the higher end. Some people, they need to be at a different range. And what we're trying to work out is what is optimal for you in the middle. And one of the things I talk to people about is something like thyroid is a good one, but also like iron levels. So conventionally, iron can range, or the ferritin levels can range anything from 20 to 200, depending on your labs.
Wow. That's
so
massive.
It's quite a big range. Yeah. Conventionally, we would look to say, okay, so you get a result and you're like 25. So conventionally, you're like, well, you're normal. But actually, most people feel most optimal between 70 to 80.
Right. Yeah.
So we are working within science to kind of go, well, okay, actually, let's push you up to 70 to 80 and see how you feel at that point. And generally, you're feeling a lot better at that point. And this is the same with thyroid. The conventional levels with thyroid, I think for TSH, which is one of the markers that we use in thyroid, is anything between 1 and 4. I think in conventional, it can be anything like that.
Yeah.
But actually, most people feel better between 1 and 2. So we have a narrower range that makes you feel better. So we're working to sort of biochemically optimize you as well as, optimize you in living the life that you want to live.
Yeah. That makes sense, doesn't it? Because those numbers are arbitrary as well. With the thyroid, for example, 1 to 4, conventional medicine says is normal. But then 4.1 is high, and we need to do something about it. Well, what we should really be doing is saying, well, and it'd be great if we had this information, well, you've actually been at 1 for the last 15 years of your life. So 1.5 actually is you going up. We need to be aware of that too. You've doubled. Not waiting until they get to 4.5, 6, or higher, because it's what's right for that person.
Absolutely. And I think that's the key part of one of the things that functional medicine has a potential of doing is being very preventative, being very proactive. At the moment, our clinics are very much those at the end of their tether, been through everything, haven't really got anywhere else to go and come to us, which is fine. We can still unwind and look at everything. But with the research that's coming out, there's so much that people can be doing and seeing and monitoring way before they get to that point where the symptoms are just out there. Because as I said at the beginning, our body has the capacity to tell us. We are being told at every point what's happening. And that's one of the things that we do in our clinic. We start at birth and work all the way up to where we are now. Because that helps us to understand all those little signs and things that your body's been telling you. And then finally it all collapses in front of you. And then, yeah.
How does your birth influence your later health?
So there's a lot of research coming out in terms of how you were born, like if you were a cesarean versus a normal vaginal delivery. It has an impact on something called the microbiome. I say something, some people may not be aware of it, but it's your environment of your gut and all the bacteria that are sitting in your gut. And there is so much research coming out about the impact that your microbiome has on your physical health. Your microbiome is like this whole ecosystem which is producing so much stuff that I don't think we're really aware of what it's doing. Mm-hmm. One thing that we do know is that there's actually more microbiome cells than human cells in our body.
Wow.
So we're kind of like a bit of a universe for them, carrying this amazing thing within us. We know certain things. We know that it can produce some of your happy hormones. It helps you to metabolize. It helps you to detoxify. It helps you to make some of your B vitamins. When we're thinking about hormones, it has a real big effect on detoxification of estrogen, progesterone, these kind of hormones as well with what's going on. So birth and the way you were born influences the kind of microbiome that you come into the world with.
Right. Okay. So you're more susceptible if you have a C-section?
Theoretically, I don't like to use that word. You're just coming with a different balance. Right, so okay. if you had it, and I think they found certain types of bacteria are more, certain types of bacteria are less. So it makes you slightly more susceptible to maybe having more infections. And then if you have more infections, then you generally would have had more antibiotics. Then antibiotics then further impacts on your gut microbiome. You then get into a bit of a cycle of issues happening.
Yeah.
That's why it's fascinating when we start at birth and then we can see how things are moving. So if somebody's born via cesarean section and then was breastfed versus bottle fed, that will then impact on the kind of microbiome as well. So then that might have a positive effect. So that's good. And then what we're seeing is like, if the kids start with ear infections or throat infections, that was the first sign that your immune system needed some support.
Right. Okay.
And
then would you then treat that with pharmaceuticals, which is, what you said at the beginning, what you were aware, you kind of knew that wasn't the answer, or do you treat it differently now?
So I would probably treat it differently if I saw a kid with these kind of symptoms. We do see some children as well. So before, if I saw a kid with, say, a lot of recurrent ear infections in conventional medicine, I would be like giving antibiotics, ear drops, this kind of things, and then probably sending him to see ENT, making sure there wasn't any like glue ear or anything like that that was coming through. Now I'd be like, what's your immune system doing? Is it actually an infection? Or do you have a lot of mucus that's being produced? Why is your body producing mucus? Is that because it's reacting to foods?
Mm-hmm.
Is that because it's something in the environment that it's reacting to? What is going on? So I'm wanting to dive a lot deeper. And then often we start by looking at food and nutrition to see whether that helps, and then finding ways to calm the immune system when it's producing all of this mucus that could be bunging everything up. And often we find that this, settles the kids down. And the other thing that we'd also be asking is, do you have everything for your immune system to actually fight an infection? Do you have all the nutrients do you need? Do you have enough protein? Do you have the B vitamins, the vitamin D, vitamin A, vitamin K, vitamin E, all of these nutrients? Are you getting that? Because often we find that mum may not have had a good nutritional set point. And as a community and as a society, we have a lot of calories or, nutrient food, but actually not a lot of nutrients in what we're eating.
Yeah. So do you think health is deteriorating? Well, obviously we know health is the worst it's ever been, in the history of the planet, which is weird because we're technologically the most advanced we've ever been. But do you think that is because the quality of our food is getting worse?
I think that's part of the equation. It's not a direct, like there's so many aspects of it. For me, I think there's a combination of the kinds of foods that we're eating, the fact that a lot of our foods are packaged and pre-processed and things like that, which means there's a level of toxicity that the body is having to deal with. On top of that, we know that the soil health isn't that great anymore as well, with the fertilizers and all of those kind of things that are happening to our soil. So we know that, we know in my nutritional therapist always talks about having selenium and in your Brazil nuts. But actually, where the Brazil nuts are grown, the soil is deficient in selenium. So you're going to have lots more Brazil nuts than you used to have. So the content of our food is also nutritionally less than what it was from what the research is showing. So there's that, and then also lifestyle. We're running at about 90 miles an hour. And, one of the things I talk a lot about in my clinic is about the vagus nerve. And the vagus nerve is one of the nerves that is our flight or fight nerve. And to me, this completely changed the way I approach my patients when I learned about this. I knew about it when I was doing my anatomy, like kind of learning what the nerves are.
Mm-hmm.
But the impact of the vagus nerve on your brain health and on your physical health is unbelievable. So is it okay? Shall I expand a little bit on that?
Yeah, definitely, without doubt.
So the way I look at it, the vagus nerve is one of the longest nerves. It starts in the head, it goes all the way down to like your gut level. And it is your flight or fight nerve. And we've all heard, I think, about parasympathetic and sympathetic, flight or fight.
Yeah.
Stephen Porges has sort of come up with a theory called the polyvagal theory. And he's found a sort of an ancestral part of the vagus nerve, which is the dorsal vagal nerve. The way I explain it to people is like a traffic light system. We have the red zone, triggered by the dorsal vagal nerve, the green zone, which is your parasympathetic, and then the yellow zone. So the red zone, when that's triggered, this is your play dead. This is like shut down.
Mm-hmm.
People who are chronically depressed, can't get out of bed, struggle to walk, blood pressure is not stable, really low, can't do anything. Psychologically, really just shut down, can't communicate, can't interact with people. And we might be able to resonate with them, might be able to think of situations that we've all been in that red zone.
Yeah.
And ancestrally, that's your play dead. That's your being attacked by a bear. What do you need to do? Play dead.
Yeah.
The sympathetic, which is your yellow zone, is like being at a traffic jam. Like a traffic lights. You're kind of just watching, you're just kind of just staying there, waiting kind of thing. So I kind of call it your kind of constant vigilance zone.
Yeah.
You're always aware of what's going on, what's coming up, what's in the future, what's in the past. All of those kind of things are always happening. Psychologically, you're kind of probably a little bit anxious, you're a little bit aware, you're probably worried. All of these kind of emotions are probably related to it.
Mm-hmm.
But physiologically, your vagus nerve is sending messages, get ready to run away. You are under threat.
Something's going to happen.
Yeah. So your physiology that happens literally from the top. So your pupils might contract, you're less saliva in your mouth, you've got less gastric acid being secreted, your gut motility slows down, your immune system shuts down, your muscles become tense. All of these things are happening. You can now see all the symptoms that we're carrying with us. We've got headaches, we've got digestive issues, we've got gut issues, recurrent infections, muscle aches, all of these things, because your nervous system is in that yellow zone.
Yeah. And that's because of the environment we're in nowadays, where it's just 100 miles an hour all the time.
So we now know that affects your gut motility. When it affects your gut motility, it affects your microbiome. And then what happens is you get overgrowth of bacteria, then you get bloating. We could go down that track. All because of being in that yellow zone.
And you mentioned at the beginning, didn't you, about the people you saw with IBS who are coming in, and now we're talking about gut symptoms again. So some of those people could have just been in the yellow zone for too long.
Yeah. So I'm sure you can resonate with the yellow zone. Us as business owners. Yeah. We're all in the yellow zone.
Yeah.
And then we have this wonderful green zone. This is rest, this is love, this is connection, this is eye contact, this is joy, this is peace, all of those beautiful, nourishing symptoms. Physiologically, this is when you rest, you heal, and you digest.
Mm-hmm.
Your body can't do those things if you're not in the green zone.
Yeah.
There's just no way of it working. It's not built to do it anywhere. So we've got all our people in the yellow zone. We're stuffing nutrients and supplements and medication to counter what the body is naturally doing. How do your brake is on, but you want the accelerator to go. What's going to happen, Ross?
Yeah. You've got me thinking there about just how life has evolved really over the last 100 years. Previously you went to work at 9, you left at 5 o'clock, and then you turned off, and you'd be with your family, and you would be experiencing those things in the green zone, true connection and communication and feelings of joy and tranquility most of the time, hopefully, with your loved ones. And now it's not. We're on our phones all the time. We're always available. So that yellow zone, I guess, has just got got bigger. you're always in it. And I think in reality, we probably, everyone who's watching this knows where they've been in those different zones.
Yeah.
And I guess all of us do fluctuate, and you go through periods, but historically maybe you would be more green than red, with a little bit of yellow, and now we're mainly yellow with a lot of red and a tiny bit of green.
And when you start speaking like this, people get that, and it really makes them understand, well, that's half of the root cause of why I'm experiencing what I'm experiencing.
Yeah.
And I think the book that I was reading, I think Why Zebras Don't Get Ulcers or something, they were saying the last research about this said that we should be in the yellow zone 30 minutes every 3 days.
Wow, seriously?
That's genetically how we were built. Like, that's the ancestral genetics behind us. Because that's when you needed to go, kill your prey, do what you needed to do, get your food, and then you'd be resting.
I suspect most people are 30 minutes every hour.
Yes.
Let alone every 3 days. Like,
yeah.
my goodness. Wow. So I guess it begs the question, doesn't it? We how do you get out of the yellow zone? What do you teach people?
So the thing is, again, body is built and it knows what it needs to do. And we need to have that flexibility. If a bear is charging at us, we want to be able to play dead. Like, we need to have that. If we need to run, if we're in front of a car, you want that vagus, you want that sympathetic drive. You just want to be able to do that. So it's not a bad thing.
Mm-hmm.
Again, it's doing what it needs to do. The flexibility that we're seeing, or the lack of flexibility that we're seeing, is that people are not getting out of that green. They're taking longer to come out of that yellow zone. And so it's harder. So then we end up with a lot of doing. So I need to then meditate. I need to stop. I need to do yoga. I need to go for a walk. And then they get into a partial yellow-green zone because they're overthinking that they have to be in the green zone.
Yeah.
The main thing that I'm telling most of my patients now, Ross, is stop. Just stop. If we can stop, our body will just find its way through. But we don't know how to stop.
It's such great advice, and it resonates because I remember a couple of years ago where I had so many what I called non-negotiables on my to-do list every day: meditate, breath work, exercise, cold shower, journaling, gratitude practice. I had all these things listed, and it got to the point where I was so stressed out that I had to get them done. It was completely having the opposite effect. And when you described it that way, they weren't green things, they were yellow things. And it was only when I think someone just pointed that out to me, and I just stopped doing everything for a few months, and then I picked back up ones that I thought might work, and now I'm not bothered if I miss a day.
Yeah, and I think that's the key thing here. You're naturally built to be in the green zone.
What a lovely thought. Because most of us take it for granted that we'll probably be in the yellow zone. You know what I mean? Like, the way life is, it's fast paced. It's 90 miles an hour, as you said. So people will be used to being yellow. They'll be used to being, anxious or ready to act. But actually, we're built to be in the green zone is quite a powerful statement.
I totally believe it.
Love it. So what else can people do then? So you've said stop, but presumably that's not just, you can't just stop anywhere. You're not going to just stop in the middle of the road or stop at work.
Well, it might be. I mean, I'm sure you've heard stories of people that just went, that's it, I'm out. And how they have completely transformed everything by just taking that. We don't want to get to the point where there's straw on the camel's back. back breaks.
Yeah.
If something resonates in this conversation and you know in your head that that's the main thing you need to stop and see what happens. Get curious. Curiosity is another word that I love at the moment.
Mm-hmm.
You know, there is a reason for you to be at 100 miles an hour. Let's get curious about it. Curiosity has a different feel to it rather than what is my next step.
Yeah. It sounds more playful and joyous than too structured. Like, what am I going to do next? Or let's see.
Because what you'll find is that when you start to be curious, you can then listen to that intuition that you have within us. You know, why did I go to this place and meet this person and this happened? We don't fully 100% know this. You know, sometimes things happen for whatever reason, we don't know what they are. And what I've started to say to people, these are the things that can get you into a green zone.
Mm-hmm.
You know, meditation, walking in nature, stopping, breathing. There's so much more evidence with all of that. But what do you need today? You know, first of all, is the awareness that you are in a different zone.
Mm-hmm.
If you don't know that you're in a yellow zone, you don't even know that there is a green zone, you can't really do anything about it.
Yeah.
It's this whole analogy of fish in water. Fish don't know what water is.
Yeah.
A lot of our patients don't even know that they're in a state of mind that is so stimulating to their body.
Yeah.
I was just
going to say, like, I bet when you ask a patient, when you ask a client, what do you need to do? I imagine that's quite a difficult question for a lot of people. Like, I don't know. What do I need?
But if you allow them the space, which is part of what we're trying to create at the clinic, a safe, open space for you to explore what you need, we'll give you the evidence behind it. We'll test it. We'll do the kind of medical things, but we'll be there to support you to experience it.
Brilliant.
You know? Because that's where it comes from. Not everybody, you know, meditation doesn't resonate with everybody. You know, and sometimes going for a walk, people are not ready for that. You know, they might want to dance, they might, you know, and we are here to just kind of go, well, what is it that your body needs today?
Mm-hmm.
Just feel I need to move. Right, what are we doing? What can we do to move? It's not about being prescriptive. 15 minutes a day, 3 times a week, 30 minutes of cardiovascular. It's not about that.
Yeah, it's about listening to what you need. So functional medicine is really quite different then, isn't it, than what you get in your local hospital or from your local GP?
I mean, the conventional place is so important. You know, for me, conventional medicine deals with acute emergencies beautifully, wonderfully well.
Mm-hmm.
If I had a heart attack, I do not want to see a functional medicine doctor. If I had some growth somewhere, or if I had an accident, I want to go and see my conventional doctor. I need them to do what they're very, very, very good at doing.
Mm-hmm.
Any kind of chronic illness, you want to see a functional medicine doctor.
And are there lots of them out there? Are there, are they in every town in the UK? Are they all over the world?
They are growing. The community is growing. But just to put this into perspective, I did my training via the Institute of Functional Medicine. And I think we've only just got to 2,000 fully certified practitioners in the world.
Wow.
So there's not a lot of us that are fully certified. There are people that are, And I think in the UK, the last time I looked, those that are registered on the IFM website, and IFM is not the only training program, there are other training programs out there, but I think there was about 190 people in the UK, and that's not all medics, that's nutritional therapists as well. I think in total there's probably only about 20 to 50 practices in the UK that are doctor-led.
Wow, and how many regular doctors are there?
Yeah, that's it. There's probably about, I think at the max that are fully practicing, because I'm part of a big community of doctors in the UK, probably fully practicing, I know off the top of my head, 25 clinics, that's it.
And yeah, sorry, maybe I didn't ask it right. How many doctors are there in the NHS or in the UK?
Oh, in the UK, oh my gosh.
Thousands.
Thousands, hundreds of thousands of doctors. Yeah. So you can see we're a tiny, tiny community. And we are growing. And we're realizing that this is what is needed. But we are literally the tip, like we're the front leading the charge there.
Yeah, like the vanguard. Do you find any pushback from traditional medicine?
There is. And when I first started, I was probably quite guarded with what I said.
Mm-hmm.
But I think once you start working with it and you see people get better, you see people change their lives, you see people really start to live and be and do their best, you can't deny the impact that we're having on patients. The last patient that we looked after who was struggling with anxiety, struggling with gut issues, she's now gone back to her dance lesson, she's running her own business, she's traveling, she's ready to take the next step in her life. And you're just like, I've got to shout about this.
Yeah.
People need to know about this. It's not a quick fix. That's probably the other thing that functional medicine isn't. And you've got to be ready to be curious about your health.
Yeah. And not just want that quick fix. Just give me a pill. I want to take a tablet. I want to leave, and I'm going to go back to my busy life.
Yeah. If that's what you want, we're not the right team for you, and that's okay. There are others out there that are doing that and that can support that journey for you. If you're ready to dive in and really take a really good look and be curious and really understand what you're made out of, we're here for you.
Yeah, that makes sense. I used to say something similar when I was treating physio. Someone would come in and I'd say, look, this is not going to change overnight. If you want someone just to rub your back or rub your knee and you're going to be okay, well, that's not me. I'm going to send you away with a load of homework. It's going to involve exercises that you do frequently. It could probably involve changes to your diet, changes to your work environment. And if you can do all that, you'll get better over a period of time. And some people never came back. So.
And that's okay. And I think this is the thing that I've learned in my journey is that everybody's on their own path.
Mm-hmm.
And as long as me as a team and me as an individual allows them to just open up and see just something different, I've done my job.
Yeah.
And that's enough. Even if it's just a discovery call where I can explain one thing for them and then they go away and they've made a change. Now, I had a lady who I had a discovery call with, and I said, oh, have you heard of this thing called, I think it was like the Gupta program or something, which was a sort of a vagus nerve training thing that is available. It's another way to get into the green zone. And so she went away and did that. Then she came back after 6 months. She says, totally transformed my life. I'm now ready to do the deeper work. That's fine.
Which is amazing, isn't it? Yeah, brilliant feedback. So you've mentioned, a lot about changing the internal, allowing the body to heal itself with supplements, dietary changes, taking things out, putting things back in. What about external things? What about exercise? Does that form a part of it? Because again, if you think of traditional medicine, we have again arbitrary numbers. You must do 10,000 steps a day, and things like that. So, do you teach people about that as well?
Yeah, absolutely. We have this sort of a template of how we talk to our patients. We have what we call the matrix, it's called. And the matrix has all the symptoms in one particular area. And at the bottom, we have something called the modifiable lifestyle factors. We can't control what the body's doing. Like physically, we cannot, that's what's occurring. The modifiable lifestyle factors is what we eat, how we sleep, how we move, how we rest and relax, and the community around us. These are all the only things that we have any control over.
Mm-hmm.
And they have the biggest impact on how your body works. So how we think and how we relax is all to do with that vagus nerve. Finding a way to understand how you're interacting with the world around you.
Yeah, and that's
how
your meditation, you walking in nature, that type
all
of
of these kind of things. Yeah. And also just understanding the psychology of how you view the world. Are you someone glass half empty? Are you someone glass half full? Do you have a red pair of glasses on because you're in the red zone and therefore everything is annoying you? Yeah. Are you someone that's in the green zone and looking at the same picture when you were in red zone and you're like, yeah, it's fine. Let's become aware of that. How we think is the highest amount of root cause you can get to.
Yeah, so your perception of reality really, isn't it, changes what you see. Because if it's raining outside, you can be like, oh no, it's the worst day ever. But there's a farmer around the corner going, it's the best day ever. It hasn't rained in weeks. So it's the same event. You're just looking at it through a different lens.
Yeah. And I love speaking about this to patients because then they start to think, oh, okay. Because even a symptom, and I'm sure you've seen this, Ross, in physio, somebody has a very same thing. One person is like, oh my God, disaster. The other person is, all right, it's a sprained ankle.
Yeah, definitely, without a doubt.
And that will impact on how your body heals.
Yeah.
So you're not adding all of those vagus nerve impact, all of those kind of things to it. You're just acknowledging and affecting it. So how you think, how you eat. Food is medicine. There's no way around that. Because that's information that you are giving 3, 4, 5, 6 times a day to your body. And it will impact on how everything.
Yeah.
The little microbiome that you're feeding with that. It's giving you the information of all the nutrients that you need for your immune system to work, all of those kind of things. That is the second key bit.
Yeah. I guess food should be medicine.
Yes.
Than it is. Because if you eat a McDonald's or a hamburger or something, it's not the same, is it, as eating whole, organic food.
Yeah, I mean, it's like, I think Mark Hyman talks about this in his podcast. Like if you said to me it's anything to do with calories, well, if you had 1,000 calories of broccoli and then versus 1,000 calories in your McDonald's burger, I think your body will work slightly differently.
Yeah, without a doubt. I've actually just got some of his books. They just arrived the other day. They're just behind me there.
and it's then it really makes you think, because we've all been brought up in a calorie controlled world.
Yeah.
And so we're re-educating people about the benefits of fat. I mean, with your clinic, one of the things that we see with hormones, testosterone is made from cholesterol.
Yeah.
So we're living in a low cholesterol world. What's going on there? How is your body supposed to create testosterone?
Yeah, it's a fundamental building block, isn't it? But it's been almost vilified as, the fat is evil, cholesterol is bad, and actually it's not. It's the building block of many of our hormones.
Building block of your hormones, your nervous system, your brain. All of these things need those kind of things. So we're doing a lot of re-education about that. So those, first is the stress, second is your nutrition, third is sleep. Sleep is, I think I was listening to somebody that sleep has the biggest benefit on mental health than taking an antidepressant, basically. I think that was the underlying factor that was coming through in the research. Just making sure that we prioritize sleep is so key to health and well-being.
Yeah.
Sleep impacts on so many aspects of our and how our body works. Fourth tends to be the movement, because I think, again, it's about not structuring it. But one of the things that I love about movement is that there's some research now showing about movement creating something called BDNF, brain-derived neurotropic factor. This helps you to grow new brain cells, like it helps you to make more connections.
Wow.
So they're actually saying that when people who have got Alzheimer's or dementia or memory problems, movement can help you have more of this, and that helps you to create more new connections. How amazing is that?
Yeah, okay, that makes sense as well. If I think back to my physio days again, as a neurophysio, and when you're rehabilitating someone after a stroke, for instance, you go through movement pathways with them to get the neuroplasticity. So it stands to reason that shouldn't just happen after a stroke or a head injury. It's there all the time.
Exactly.
Yeah.
Exactly. And it can be any kind of movement. And one of the chaps that I was speaking to, he says the more kind of complex movements, like doing repeated things in a sort of a different pattern, allows you just to reconnect different pathways. So even if it is a case for some people to put on a piece of music and just boogie,
Yeah,
and do what their body feels like doing, that's enough. You get into the point of with movement about, how much do we sweat, and are we increasing our breath, are we getting breathless? And yeah, if we're going to start doing cardiovascular and training and all of that, that's fine. But I'm working with the sick.
Yeah.
Yeah. If I can work with the well to do proactive stuff, it's a different set of factors altogether.
Yeah, definitely. People often ask, don't they, what's the best exercise? And it depends. It depends on what your goal is. If you want to run a marathon, well, lifting weights might not be the best one. You probably need to get some miles in your legs.
Yeah.
If you're rehabilitating an ankle, then there's a different exercise. And if you are unwell, then it might be any sort of movement.
Yeah, any sort of movement. Because it's quite interesting. I had a patient today who was saying that they weren't able to do any cardiovascular because they felt really ill after it. So they were doing mainly weights. When you look at their picture, you realize that they have had chronic stress. And with chronic stress, we know that it affects the adrenal glands. So even without doing any testing, I'm already working on the fact that probably she's got a bit of adrenal fatigue, feels like it's not the right thing, but a bit of pressure on her adrenals.
Mm-hmm.
And that's why her body's already naturally telling her, don't go and run on a machine, because you're not going to feel very well. You don't have the capacity to do that.
Yeah.
And we see this with people who are like trying to lose weight and going to the gym all the time, and it isn't working. Well, what is your body trying to tell you?
Yeah, absolutely. That makes sense. So we've got the mental side of things, we've got the exercise, you've got the nutrition, sleep, and what was that?
Community.
Community.
So the people around you and your environment has a massive effect on what your body's doing. Mark Hyman wrote a book a few years ago called The Daniel Plan. And what he did, I think he was a pastor in an American church, really big American church. And what they did is that they said, look, my church everybody's really overweight. What can we do about it? And what they realized is that everybody in the church had a particular way of eating and being and doing and everything else. So Mark Hyman went in, taught some of the kind of leaders of the church about the basics of everything that we've talked about. Then as a community, they all learned to eat in a certain way, move in a certain way, do those things. So as a group, then if you go to somebody's house, they're also eating similar to you. So that it doesn't feel like an imposition. It doesn't feel like anything. They all lost over 100,000 pounds of weight as a community. So the power of community is unbelievable. So understanding what's around you and the impact of the kind of house you're living in, the kind of environment in, how far is it to go to a park, or how, all of this will have an impact on how your body is working. If you're living in a moldy environment, if you're exposed to a lot of chemicals, that's not quite community, but it's your environment that you're living in. And the people around you who know about the effect of toxic relationships, because that's you in the yellow zone. So it all interconnects back up again.
Yeah, absolutely. So it's a broad picture, isn't it, then, that we're looking at? And I think that's what I loved about when we were working together in functional medicine in general, is it's holistic. It looks at you as a whole, as a person, rather than there's your symptom, here's a sticky plaster, off you go.
Yeah. And I think this is the beauty of being in a collaborative care practice, is that each of our specialists in the practice will see a slightly different aspect of the human that we're treating. We're not treating a condition. We're treating that human, that spirit, that wonderful essence that has come to us. And when we have our collaborative care meeting, we say, let's bring this person into our circle. And we allow the team to see them. So our nutritional therapist will see that side of the person. What is they eating? What is impacting on their eating? Because we found out about patients that me as a doctor would have never known. Like one patient, mother-in-law is ill and is sleeping next to the kitchen. So she struggles to cook because of the impact that it has on mother-in-law.
Yeah.
And one lady really just wanted to have a dog, and that was creating quite a lot. She was never going to mention that to me. But our nutritional therapist and our coach, they allow that aspect to be opened up and explored. And actually finding a way for this patient to get a dog totally transformed her life.
That's amazing. So if someone comes to work with you, then it's not just you, it's your whole team.
Yeah, we recommend that they see the team. In England, because of the conventional way of working, people think that it's just the doctor. I just want to see the doctor, because they don't quite get the other aspects of it. But once you start to understand that there's so much more to you, I am not the person to do all of it. And I know I'm not the person to do all of it. Mm-hmm. I can really get to understand your biochemistry, understand what's underneath this, recommend nutrition, recommend lifestyle changes. How you impact this and how you implement it comes from our coaches as well as our nutritional therapists. Because I'm sure you remember, like if you're saying, right, I need to do an elimination food plan and this is the things that I'm taking out, you're like, okay, that's great. But how do you do it? Yeah. How do you make it interesting and something that actually can work for us to actually get the outcomes that we're seeing? That's where the team comes into it. I'm happy to see people on their own, and just if they just want to have a little snapshot of this is what I need at the moment, absolutely fine. Yeah. But the power comes within that team.
Yeah. The community, you could say.
Yeah, 100%. Yeah, exactly. Because we now have on our team, we have a endocrine consultant who deals with all the hormones, diabetes, thyroid issues. And we also have a psychiatrist as well on our team. So when we have our collaborative care meeting, we're all in there. So if you come to see me, you're actually our psychiatrist will also be seeing and asking questions about, why is this coming up for that person? Our endocrinologist will be saying, what's happening with their blood test? So they're seeing it from a slightly different perspective. So you're actually getting a very powerful team when you're working with us in the practice.
Yeah, that's amazing. And I'm obviously bias, because I think you're great. But if anyone is watching this and they think, they want to reach out to you, anything you said has resonated, how do people find you? How do they make an appointment? What's the process?
So we have, our website is drindra.co.uk. Via that, you can book what we call a discovery call. It's a free 10-minute call with any of our practitioners or with myself. And we can go through where you are, what's going on. And the idea of the discovery call is to just answer any questions, anything that you feel that you need a little bit more information out. It's not a doctor's appointment or anything. It's more of a discovery as to what it's about. We want to know about, where do you want to get to? What is your dream? What is the outcome that you're looking to get to, and how we can help you to achieve it. So you can book a discovery call with us. We also do free webinars every 3 months. The last one was all about hormones. The next one is going to be about metabolic health. So that's all about blood pressure, weight, diabetes, cholesterol, all of these kind of things. That's happening in June. And that's a free webinar. People can sign up for that as well. And you can see our team and us speaking to those questions, and you can ask questions there as well.
Ah, fantastic. And presumably you're on LinkedIn and the other social channels as well.
Yeah, so we've got LinkedIn, and we've got Instagram and Facebook as well. The Dr Indra Specialist Functional Medicine Practice. You can follow us and see what we're up to.
Yeah, fantastic. Well, as I say, I'm biased, but I think you're great. So hopefully lots of people get in touch. I've really loved our conversation. I feel like we could chat all day, but I'm going to let you get on with your day. And I'll speak to you very soon.
Thank you so much for having me, Ross. Take care of yourself.